70 million people have been affected by the HIV and AIDS virus. 35 million have actually died from the HIV AIDS virus since the beginning of the epidemic, according to the World Health Organization. HIV and AIDS is a fairly new disease that is still being researched. This disease affects the immune system and is widely spread around the world, Africa having the most children and adults affected. People have many theories and have told many rumors of how the HIV and AIDS epidemic occurred. People have even called this the gay disease, the homosexual disease. Rumors have even said that HIV and AIDS began by humans having sex with monkeys. But as research has been shown, this is false statements. First, I will inform you on how HIV and AIDS began. Then I'll explain to you why people are still and are dying from HIV and AIDS. Then I'll explain to you the treatment. There are two competing theories. The first theory being, researchers identified a strain of SIV in chimpanzees. SIV is the simian immunodeficiency virus found in chimps. SIV jumped to humans and mutated to HIV when people began eating the infected chimps. As people would butcher the chimps for the meat, sometimes their blood would get into the wounds of the people butchering them, and that could also infect the person eating and also butchering. There's a case that was found first in the Dominican Republic, although this did occur in Africa. The second theory is the OPV AIDS virus, the oral polio vaccine. The oral polio vaccine, they kept hosted inside of the cell of a chimpanzee. After people began receiving the oral polio vaccine, 4 to 20 years later, people began getting infected with HIV and AIDS. So researchers believe that being that the OPV was hosted inside of a chimpanzee cell, that SIV could have been in the vaccine. The spread of HIV and AIDS is only possible if certain body fluids meet mucous membranes or damaged tissues like wounds, but they can also be transmitted through directly transmitting through a dirty needle or directly into the bloodstream. Although in 1981, when this epidemic began, most people ended up dying from AIDS, but research has been to prove that people don't necessarily die from AIDS. Most people who die from HIV and AIDS don't actually die from the virus itself, but from the opportunistic infections. Opportunistic infections take advantage of a weak immune system. Things that wouldn't make a normal, healthy person that is not immunocompromised not sick, it would make someone that is immunocompromised sick. How somebody with HIV and AIDS is diagnosed, according to the CDC, a CD4 T cell count in a normal person should be anywhere between 600 and 1500. In a person that is diagnosed with AIDS, the CD4 T cell count is below 200. So this would cause somebody to certainly be immunocompromised. HIV virus does not actually cause death, but the infections that occur with HIV and AIDS is due to the weakened immune system, and it will cause this person to be sick. There's 26 known conditions found of opportunistic infections, but these are the ones I'm going to discuss that is most common. Pneumonia, tuberculosis, Kaposi sarcoma, encephalopathy, and wasting syndrome. Pneumonia is a pulmonary complication, and this is usually and probably the #1 cause of death. Pneumonia you can see with the smoky, cloudy area here. That's what pneumonia usually looks like. This is pretty significant pneumonia on the right side. Difficulty breathing, a dry cough, and fever occurs. One of the most common types of pneumonia is a fungal infection in the lung called pneumocystis. Recurrent pneumonia is life-threatening. There's also another pulmonary complication, which is tuberculosis, which is caused by the bacteria Mycobacterium tuberculosis. This is the little bacteria that's affecting the lungs, although it can affect the brain and other organs as well. This is spread through air. You see symptoms of cough, tiredness, night sweats, fever, shortness of breath, and all of these things last for several months. and a lot of times you'll notice hemoptysis, and hemoptysis is blood-tinged sputum. So whenever you cough, you may notice blood in the tissue or in your hand. Kaposi sarcoma is one of the most common things that I have seen. It's a cancer caused by the virus of Kaposi sarcoma, herpes virus. You can see that there's areas where it could be either flat or raised, scaly, and this is caused by the capillaries, which is a type of blood vessel that it's found right up under the skin, and they're found throughout the body to grow abnormally. This is life-threatening when it's affecting other organs inside of the body. Encephalopathy is a brain disorder due to HIV. It can occur as part of having chronic HIV infections. This causes inflammation of the brain, and people will call it AIDS dementia because these people are very childlike. It causes cognitive, motor, and behavioral features that are seen in children. These people are also very forgetful. This is wasting syndrome. This is involuntary loss of more than 10% of a person's body weight. They will be experiencing diarrhea, weakness, and fever that lasts more than 30 days. And you can see his loss of muscle mass. A lot of time wasting syndrome you'll notice in the temple area, the dipping and the bone structures of the face. You'll see it in the clavicles. On him you can see the ribs, his fingers. You can see pretty much every bone in his body. When people are first diagnosed with AIDS or HIV, they may have flu-like symptoms that may reside, and this is called the latency stage, and this can last several years and then progress to AIDS. This is less common now. The opportunistic infections is less common now, and that's just due to the treatment and the medications that follow. Luckily, 6 years after the start of this epidemic, medications has been found and been approved to help prolong the life of people with HIV and AIDS. There is currently no cure for HIV and AIDS, as we know, but there is treatment which can suppress the HIV virus and prolong life. In 1987, AZT became available as the first antiretroviral medication. Antiretroviral medications work by preventing the virus from multiplying and giving the immune system a chance to recover and fight infections. This medication can also decrease the risk of transmission, especially during pregnancy. Many drugs are available now, and they're used in combination with other antiretroviral medications called antiretroviral therapy. These medications, you may be prescribed 2 to 3 different medications, different classifications of medications. These work in combination with each other, and it just depends on the person which type of medications they're put on. This affects drug interaction, drug effects. It just all depends on the person. Researchers has also found that penile circumcisions will also decrease the risk of transmitting and, of course, contracting the HIV and AIDS virus. In conclusion, by the time doctors realized what HIV and AIDS virus was, it was already permanent in humans. There was no way to know about it, but then at least researchers could be wary of the disease. Biologist Betty Korber says, the fact that it could be with us for quite a long time before we realized it was kind of eye-opening and helps us see and stand on our toes and understand that we still can be surprised. AIDS continued to surprise people from all over by the amount of people it was affecting and the deaths that were still occurring. No one knew where this disease or virus came from, what this virus was, also what was making people die so quickly from this disease. Doctors hardly knew anything about it and what they could do to stop it. The standard precaution for AIDS in 1981, whenever this epidemic occurred, people wore masks, they wore gloves, they pretty much wore hazmat suits. Currently, HIV and AIDS, you are standard precaution like you are with any patient, and you just make sure you wear gloves and follow standard precautions when caring for a patient. You do nothing special with an HIV and AIDS patient versus a regular patient. Although HIV and AIDS is still being studied, there is documented cases where people with HIV are still living with an undetectable viral load due to the AZT treatment. Researchers are working hard to make a vaccine for HIV and AIDS, but this is difficult due to the diversity of the virus. Hopefully soon this will become available, and like the polio vaccine, will hardly ever be seen in humans. Thank you.